In this video, we will cover topical medications, such as creams, ointments, as well as topical patches. Topical medications. As with all medication paths, ensure that you are washing your hands for at least 20 seconds and wearing gloves. You're going to position and drape the patient. You want to ensure that you're inspecting the skin and cleansing that affected area. Pat it dry or allow it to air dry, depending on the assessment. If you have a lotion, ensure that you're shaking it to properly mix, and then cover the skin with dressing if it is ordered by the physician after you've placed it. After you have placed that topical medication and the dressing if appropriate, reposition the patient and cover them. You're going to dispose of any soiled supplies, and then ensure that you are again washing your hands for at least 20 seconds. You're going to properly document that dose as well as the site that that dose was applied to. When administering transdermal patches, you want to ensure that you're checking for any old patches from the prior dose on the patient and making sure that you are removing that before placing a new one. You want to check the skin for any sign of irritation from that prior patch. If there is, ensure that you are reporting that to the proper person according to your facility's policy. That can be the pharmacy, that can be the physician, or your clinical team as indicated. If it is your facility's policy to mark that patch, ensure that you do that before you apply it to the resident's skin. If applicable and if needed, remove any hair from the area where the patch will be placed. Ensure that you're holding that patch in place for 30 seconds. You just want to ensure that that adhesive is properly in contact with the skin to ensure a proper hold. If needed, you can place tape around the edges if that patch begins to pull up before it's time to replace it. Ensure that you are washing your hands, again, after the application for at least 20 seconds. And if you have a patch that you feel needs to be cut, please give us a call first before you cut that patch to ensure that it's one that can be cut.